causes, symptoms, diagnosis, prevention, vaccines, treatments, future research, conclusions, acknowledgments, and remainder of the author. Background. So, mycobacterium tuberculosis is a single agent, and its proper name for it is pulmonary tuberculosis. The abbreviation for it is TB. Tuberculosis usually attacks the lungs, and tuberculosis weakens the immune system. There are 3 types/stages of tuberculosis: inactive, latent tuberculosis, active tuberculosis, and disseminated tuberculosis. So tuberculosis usually starts at the lymph nodes, which is the immune system, and from the lymph nodes, tuberculosis will spread from there. And it is a bacilli bacterium. As you see here, there are the lymph nodes in the throat, and from the throat, it's even tuberculosis is most common in the throat because you can breathe the bacteria from the nose and it will go down the throat, and from the throat it will spread. History. The man who discovered tuberculosis is named Mantoux, and he is known as the father of Western medicine, and he was born in the year of 460 BC, and he died in the year of 370 BC. And he named tuberculosis Prevalence, and that's a legitimate. The man who found out that discovered tuberculosis was contagious. His name is Untitled Chapter, and the experiment that proved this theory was first ignored because scientists didn't think that his experiment was validated until they reenacted his experiment and showed that this theory, experiment was validated. The man who found out the bacteria that caused tuberculosis, his name is Robert Koch, and he discovered this in March 24th of 1882, and he won the Nobel Peace Prize in 1905 later on. The major epidemic of tuberculosis happened in the early 1900s, and this epidemic has killed millions of people. Tuberculosis has killed different age groups, and there is no cure or vaccine because doctors had no idea what antibiotic or vaccine could kill tuberculosis. And the epidemic ended around the 1970s after the doctors had discovered that vaccine. And here you see a poster of a man covering his mouth. And this was put up all around the streets where tuberculosis was more prevalent at in the United States. And it's a man who's covering his mouth because it says on the bottom that careless spitting, coughing, and sneezing can cause, you can spread influenza tuberculosis. So they were trying to find ways to help people not get infected with tuberculosis, and they're trying to help people stay at home if they feel like they do have tuberculosis or influenza. Statistics. So over 2 billion people have latent tuberculosis, and an untreated person with tuberculosis can infect 10 to 15 people in a single year. A person dies of tuberculosis every 20 seconds, and tuberculosis in overall has killed 1.8 million people in 2008. 9.4 million people have died in active tuberculosis in 2009. 10% of people with latent tuberculosis will get active tuberculosis. And many third world countries cannot afford the vaccines even though they cost around $20. So here is prevalence, and this is a map showing where tuberculosis is mostly found. So here in Canada and Alaska, there's only like a small little section there. The United States is really not really prevalent to it. It's a lot of the United States has a lot of vaccines, so many people are immune to tuberculosis. Mexico and South America, they have a lot of people who are not immune to tuberculosis, and they're mostly affected there. If you go along Africa, India, and Asia, there's a lot of people there that are infected with tuberculosis, and little islands of incubation. Symptoms. So there's many symptoms since there's many stages and types of tuberculosis. So for active tuberculosis, their symptoms is cough, weight loss, fatigue, fever, night sweats, chills, loss of appetite, coughing for 3 weeks or more, coughing up blood, chest pain, pain to breathe and cough, and wheezing. For latent tuberculosis, there is no symptoms because latent tuberculosis is the first stage of tuberculosis, so it shows no symptoms. Disseminated tuberculosis, it's cough, fatigue, fever, general discomfort, loss of breath, sweating, and weight loss. Causes. So ways to contract tuberculosis include sharing toothbrushes, sharing food and drinks, breathing in bacteria, or eating off already infected utensils. And tuberculosis is very contagious except for Latent tuberculosis because Latent tuberculosis, as I said at my previous slides, it's the beginning stage. Diagnosis. So one way to find one of the most popular ways to find out if you have tuberculosis is this Mantoux Test, other known as the skin test. And what it is, it's you're getting an injection under the skin, and what's in the injection is PPD. And it takes 2 to 3 days to know the results. And you'll know if you have tuberculosis or not if you have scabs or rashes around the injected area. Preventions. So if you have tuberculosis, you should stay indoors. You should always cover your mouth. Wear a mask if you, because it's better to wear a mask because sometimes you can cough unexpectedly and you won't have time to cover your mouth. And you should never share drinks or food or utensils if you know you have tuberculosis, because there's always a possibility that you can affect another person. Treatments and vaccines. So there's many medications to help treat tuberculosis. It's the four most popular medications are Isoniazid, Rifampin, ethambutol, pyrazimide, and they're all equally effective, but they all have different side effects. So for the side effects for Isoniazid are jaundice, which is the yellowing of the eyes or skin, dark colored urine, weakness, pain in the eyes, which is like blurry vision or your eyes hurt, and fever. For Rifampin, you get blistering, rashes, eye aches, dark urine, pain all over the body, especially in the abdomen or in the back, and especially in the legs. Unsteadiness, you can't have any, you feel really confused and you have no coordination of your movements. And weakness. For ethambutol, your vision changes. What that means is that your vision will get worse. You have rash, numbness, especially tingling on the toes and fingers. You have confusion and fever. For pyrazimide, you have jaundice, which is the yellowing of skin and eyes, rash, fever, joint pain, vomiting, and you feel nauseous, dark urine, and swollen joints. Vaccine. So the vaccine is called BCG, and this prevents the spread of tuberculosis, and it's mostly recommended for children and infants living in highly prevalent countries. And this is not recommended for the people of the United States, since, as I said before, many people here are immune to tuberculosis. And it's also recommended for people who are living out of the country or going on vacation out of the country for the simple reason that you can get tuberculosis. So for future research, the only main focus is to eradicate active tuberculosis, since active tuberculosis it kills a lot of people and it affects a lot of people, and it's the most deadliest and it has the worst symptoms. So my conclusion. Many people should be aware of their surroundings and detect who has tuberculosis. Many people should know what it is tuberculosis, and how to prevent it. And third world countries should know how should be able to afford vaccines and to help people get immune to the disease, because especially in the third world countries, there's so many people that die there because they don't have vaccines or any treatments. And my acknowledgments are to my roommates, Stephanie, Colin, Sydney, Maddie, family, Dr. Nim, Dr. Mendes, and as well. So now I'll open the floor to any questions.
Why is the vaccine not recommended for people in the U.S.? Because we're immune. How are we immune to the vaccine?
Because many people here have vaccines and treatments, and a lot of people have been injected with the vaccine when they were infants.
Where did the disease originate?
That is not sure. As I researched, It's been, tuberculosis has been in the world since like ancient times, so it's not really sure where it originated from. Jacob?
What is PPE?
I haven't covered that in my research stuff. That's vaccine. Data?
So for the, is there any future research that you came across from your research